Hello, I'm Dr. Zubkov. This video is an introduction to my YouTube community. I'm a neurologist with specialty in stroke and neurocritical care. As you can hear from my accent, I'm Russian. I finished my medical school and then I finished my neurosurgical residency in Russia, and then came here and finished all the rest of the training here. My whole life I have been taking care of very severe and sick patients, and I thoroughly enjoy that, but I started to realize that really what we're doing with saving their lives, but we're not really improving their health. I started seeing more and more patients that were younger and were coming with strokes with the same risk factors as my elderly, like diabetes, hypertension, obesity. And we were trying to treat them with the same medications, same approaches as our elderly, but we were not getting the same results. Patients were coming back with more strokes, with more complications related to their diabetes, to their hypertension. So in reality, I started thinking, well, they have another 50, 60 years to go, and really we're not getting their health back. We're just trying to manage symptoms and really trying to patch the holes, but there are more holes coming in. So for the last 10 years, I delved into functional medicine approach to disease management and really to health management. I don't want to say disease because our body is a whole. We cannot really treat just brain and ignore everything else and just think that we'll be able to prevent strokes. As an example, diabetes. I mean, if you don't really treat diabetes appropriately, then you're not going to prevent strokes, heart attacks, and all the other complications related in other organs without really treating the underlying disease. And again, treating diabetes with just general medications really gets your numbers a little bit lower, but does not cure you. What I was really interested in is figuring out the root cause of why young patient will come to me with a stroke, or why young patient will come to me with hypertension and subsequent bleeding in the brain, or why patients come to me with headaches and just not getting better with all the kind of general management. So what I focus currently is on managing of 4 areas in our health. One is an environment, one is lifestyle, and another one is mindset, and then also we take care of nutrition. A lot of physicians, a lot of functional practitioners really focus on nutrition, and it's absolutely important, no question about it. But that's not the only solution. If you have poor environment, or if you're stressed out all the time, or if you don't sleep appropriately, or if you're depressed, none of the nutrition will help you to get better. We need to really focus on all 4 areas in order for us to get better. Environment, just a little example, 16% of global death have been attributed to air pollution. 30% of strokes attributed to air pollution. We don't account that as a typical neurologist. We don't think about it. We just know that it's there. There's nothing you can do about it. But you can do a lot of stuff about your air quality in your house. You can choose where you go for walks. You can do a lot of stuff for your environment to improve your environment and to allow your body to get more energy to recover itself. Same thing with the lifestyle. If you're stressed out all the time, if you sleep 5-6 hours a night because you need to work really hard to make money or do something else, or you just like to play on the phone or before sleep, all of a sudden your body does not get enough energy to recover itself. Our body is the most powerful system in the world. It will get you better if you will allow it. We just need to get out of the body's way. Right now, what we're trying to do, we're trying to force the body by biohacking this, biohacking that, to allow us to continue our poor lifestyle and allow us to do what we want without really caring for the body. Same thing with the mindset. If we have a proper mindset, we will understand we need to take care of our body first, and then everything else will come sequentially. If you're anxious all the time, if you're depressed, then it will be very hard for you to recover, regardless how many supplements you're going to take. And obviously nutrition is absolutely important. no question about it. But there is no one diet that fits everybody. Some people thrive on vegetarian diet. Some people thrive on carnivore or meat-only diet. Most of the people will thrive on combination. But there are certain proportions of nutrients that needs to be given to each person individually for them to strive even better. That's where the advanced testing coming through. That's where the history coming through of what patient responds to. Because if I'll give the same diet to two different people, even the same family, they may respond completely different. One will get more anxious with eating more meats. One will get more anxious with eating more vegetables. It's not one approach fits all. I always look at the patient individually. I listen to their story. I look at their advanced laboratory testing, and then we're able to come up with a plan that will work for them. Okay? Moving forward, I will be talking about different topics. I will start giving you some ideas how to manage your cholesterol, how to manage your diabetes, how to manage your migraines, how to manage your strokes. Thank you.